I'm very pleased to be here this morning to welcome you all and bring greetings on behalf of the Director of PAHO, Dr. Carissa Etienne, and the Director General of WHO, Dr. Tedros Adhanom Ghebreyesus. Honorable Prime Minister and Excellencies, the start of vaccine rollout is a hopeful step in the right direction to fight against the virus. And PAHO is proud to facilitate this urgently needed effort in Barbados. Our region, the Americas, will have to immunize at least 700 million people against COVID-19, which is a significant undertaking in public health, of which 183,000 persons are targeted to be vaccinated in Barbados. Madam Prime Minister, please accept our sincere congratulations and appreciation for your strong leadership in the national COVID response and efforts ensuring equal access to the vaccine through the COVAX Facility, and PAHO congratulate your government as well. Thank you very much.
I'm really thrilled to join you today for this handing over ceremony of the vaccines that have been delivered through the COVAX Facility. And this is the first round of delivery of vaccine happening in Barbados and simultaneously this week in the Eastern Caribbean countries. And with a second round expected later, we expect to cover 20% of the population that will be vaccinated through the vaccines delivered through COVAX.
What can I say? The eagle has landed. And I say that because this has been really a very long journey for us, awaiting the arrivals of vaccines in this country. And I know I speak for the Permanent Secretary, Mrs. Janet Phillips, who has worked assiduously in ensuring that we reach this point, and the Chief Medical Officer as well. And we just want to say how happy we are to be able to be here this morning to receive the first tranche of vaccines, just over 33,000, for the people of Barbados through the COVAX Facility.
They say that politics is the art of repetition, and never have we understood that statement to mean more than at this particular point in time. I don't think any of you will find a different message from any of us who spoke this morning as to what is necessary for us to be able to improve the conditions of our people, as well as for us to be able to work together collaboratively to bring us back to a stage of being able to do the things that human beings most want to do. There are many who are doubtful, and we have to respect that. But we have to have the conversations as to what underpins that doubt or that sense of hesitancy. For us, we saw it change in this country, where at the beginning of this particular last outbreak, when we did the start of Operation Seek and Save, 55% of Barbadians being interviewed initially expressed hesitancy and concern about whether they would take a vaccine, and 45% said yes. Within 2 weeks, that started to change, and we saw a complete difference in the trajectory of interest in the vaccines. Within a month of that initial position, we saw and had data that suggested that 79.8%, almost 8 out of every 10 Barbadians, said, "Give me the vaccine, we want it."
Generally, I would say when we first started, the response was kind of slow. But then as we went along over the days, you find that the response pick up. And I think maybe it is because persons were just waiting to see, all right, let me see when my sister goes, or let me see when my brother goes, what happens. But after a couple of days, then the response was really great. That it just picked up as we went along. I find the most questions persons were concerned about their illnesses. For instance, someone might say, well, I'm a cancer survivor, I'm on chemotherapy, or can I still take this with my regular medication? I think those were the main concerns that people had about taking the vaccine with their medication, and also with the underlying conditions, especially those persons, the cancer survivors, that those persons were really concerned.
Persons were a little anxious with all the information on social media. But when the vaccine actually started to roll out, to be quite honest, we got a very good response from day one.
All categories of staff actually took the vaccine, whether it be the doctor, the nurse, the maid, the general worker, admin staff, pharmacy, all categories of staff, security, all categories of staff actually took the vaccine.
I had a reservation or two because they said an issue or two was arising from it. But I do a lot of reading, and just for me, it was like the benefits that kind of outweigh, the risk for me even more. I feel good, I feel better, I feel more secure. Yeah, I feel a lot more confident now, and my chances of not feeling severe illness or being hospitalized now.
At first, yes, but the more you follow the World Health Organization and you hear different things, the Prime Minister, she was very good at educating you too, and the health minister, so those fears, they were gone.
Also, another indication was persons with allergies, and it wasn't really a contraindication, but we just engaged in observing those persons post-vaccination for a longer time. And we didn't really have any serious reactions to persons. It was just minimum reactions, just what was expected with any vaccine.
And again, like what Sister Serrano said, persons with allergies, a lot of persons will come and say, I am allergic to such and such and such, can I get the vaccine? Is it okay for me to use? I did have a few persons as well who had some chronic illnesses, and again, they were asking, is it okay for me to take the vaccine? And again, like what Sister said, we directed them to the relevant websites, and we gave them the information as well, telling them that it was relatively safe, and we helped to allay their fears. So that was the main concern in terms of persons coming in.
I think that the response to this vaccine has been fantastic, overwhelming in some cases, because when we initially rolled it out, we had a large number of persons who wanted to be vaccinated for the COVID-19 vaccine. And if I compare the response to this vaccine with, for example, the seasonal flu vaccine, the response has been much greater. So there is a heightened response, I would say. We started with our own staff first of all, and we did general education sessions for them to empower them too, so that they can speak to members of the general public in an authoritative manner and educate them about the vaccine. Because we know that there are a lot of sources out there that put out some pretty scary things. So you had to be able to address the myths and the rumors and so on, and give them the facts, and also point them to the credible sources where they could read for themselves and verify the information.
One person had told me she wasn't going to, but then she said what she meant was she was going to check with her doctor before just going, and she's had her first jab. So no, I do feel more comfortable, because I tend to be away from Barbados at Christmas, and I really miss that this year. So God willing, life is there. Hopefully by the end of this year I could go somewhere.